Hi, welcome to another episode of Talking with Docs. I'm Dr. Ross Geller with Joey Tribbiani and Chandler Bing.
Nice.
So, Dr. Paul Zalzal.
Dr. Brad Weening and
Mike Heffernan.
Dr. Mike Heffernan, a cardiologist. You've seen him on some of our other videos, and today we're doing a really important topic, and it's, do I need to take medication for my high blood pressure?
Blood pressure medication.
Okay. So we talked in another video about measuring blood pressure and what it was all about, and now the question is do I need to take a blood pressure pill? I guess we were just mentioning that we prefer that if a patient can lower their blood pressure without taking a pill, that's perfect. And if you can get to a threshold that we would like, 120 over 80, perhaps even just a little bit higher, 130 over 85 even, without a medication, then that's reasonable. And so what are some of the things that you can do in order to make that happen? So healthy weight,
okay.
Regular exercise, and regular exercise, we're here in Canada, and the Canadian guidelines are 150 minutes of vigorous exercise a week.
Okay.
And you can break that up. They can be little 10-minute spots. It doesn't have to be 30 or 40 minutes of aerobic exercise all at a given time.
Don't average that over the year.
No.
Yeah.
One busy day isn't going to cut it.
Exactly.
And ideally, it's most days, right? Rather than doing 110 minutes one day, you want to have a little bit of high intensity every day.
Most days,
better for you.
Most days of the week.
Okay.
So that's healthy weight, that's regular exercise, and then diet. And so I'm not necessarily meaning go out and restrict your calories. So it's not that concept. It's a diet that is going to lower your blood pressure. So there's a Mediterranean diet, there's a DASH diet, and by and large these all have the same theme, and that's foods that are more vegetables, more fruit, legumes and nuts, and I suppose lean cuts of meat.
Sure.
If you're not vegetarian. And then less trans fats, less processed foods, less sweets and carbohydrates, less sugar. So those are all the the lifestyle things you can do. And so when we have a patient, we've made this diagnosis, we would prefer not to just throw a pill at a patient right away. It's like, nope, you know what? Here's 3 months, here's 6 months. Try and do these lifestyle changes, and then take your blood pressure at home. If you can purchase a machine, that would be great.
Yep, very affordable nowadays too.
Generally here about $100,
Yep.
Somewhere between $70 and $100. And if you can take readings most days of the week, we ask patients usually to take 2 or 3 readings, write them down on a piece of paper.
Yep.
Lots of people like Excel spreadsheets. I get
Wow.
reams and reams and that's fine.
Sure.
The more data, the better, and we can make a really good and thoughtful decision as to a few months later, do you really need to be on a medication?
Is there any evidence on the lifestyle stuff for meditation? I have read a lot of stuff about meditation and things like that, all the things that can cure and help. Any evidence on sort of a daily meditation or anything like that can reduce blood pressure?
Yep. So probably about 5 to 7 points. And the other things I was just mentioning as well, exercise, changing your diet, all of those things each contribute about 5, somewhere between 5 and 10 points in your blood pressure. It's pretty significant.
Like meditation, it's just I had 2 other ones. Obviously, thankfully, it's less common. Obviously, stop smoking if you can.
For sure.
Do your best. Does that include vaping, which sadly is becoming very popular, or not necessarily?
So I don't know the answer to that
I wonder if the
question.
nicotine might be part of it, so not sure about the vaping.
Viewer,
but
give us a comment.
in general, it's still not good for you. And then what about caffeine? North Americans, we seem to be addicted to caffeine. We need to wake up early and have lots to do.
So there's nothing wrong with a cup of coffee a
Okay.
day. It's like everything. It's like your mom says, everything in moderation, right?
Okay.
Yeah.
So now we're at the point, you've gone to the cardiologist, your family doctor, you had high blood pressure. It wasn't so high that you immediately had to seek treatment. Tried some lifestyle stuff. We're talking a couple weeks?
Few months.
Few months, okay.
Yep.
A few months, you come back, you've done your blood pressure at home, it's still elevated.
Yep.
Now you have to have the conversation about medication.
Medications.
Okay.
And there are lots of medications that we can use. We're not restricted to one. There are numerous classes. They all have their quirks. There are diuretics, which are common.
Right.
We don't often prescribe diuretics, for instance, for a young active individual where they might have to go to the bathroom in the morning often.
So diuretic is a medication that makes you pee out fluid.
It makes you pee out fluid, but it lowers your blood pressure.
Right.
There are things called ACE inhibitors. There are things called ARBs. There are things called calcium channel blockers. There's a whole host. And it's really what your physician is going to do is, speak to you, get an idea about what kind of your lifestyle, your preferences are, and then make a choice. And they're all good.
Okay.
And most often, I think it's important to know, is we have to combine them.
Yes.
Because often, we know that an average Canadian requires 3.2 blood pressure medications at their maximum dose to achieve the target blood pressure.
What? Say that again.
Yeah, three.
So the average Canadian
Needs
three
blood pressure pills.
Three different types.
Three different types at their maximum dose to achieve adequate blood pressure. So if your physician is saying, hey, look, you're going to need to be on a pill, hopefully you only need one.
Right.
Hopefully you can do all those lifestyle changes so you don't need the other two.
Right.
But sadly, as we get older, a lot of patients require more than one.
So in anticipation of the flood of big pharma comments that we're going to get, what is the percentage of people that have success with the lifestyle modifications? So say, listen, I got down to a healthy weight, I now eat mostly plants, I exercise regularly, I quit smoking. Like, what are the chances of saying, listen, you get to come off your medication or you get to not go on it?
It's high.
High. So there's a very real chance of success. The trouble is the things we're suggesting are very hard to do, right? That's why we have people that have weight problems and high blood pressure. It's because it's easy to say, it's hard to exercise every day, it's hard to eat right, it's hard to
carve out that time.
Right.
Yeah.
To the person who's typing the comment right now that's saying these guys are paid by Big Pharma, just ignore them. Trust me, we are not paid by Big Pharma in any way. We're just telling you what the scientific evidence and the data suggests can lower your blood pressure and thereby prolong your life, I would imagine.
Yeah.
Right?
So then my last question would be, so now I've been on them for, someone's going to say, I've been on this for 20 years.
Yep.
Is it still worth a crack at the lifestyle stuff? Do you ever not see people who have been on it and say, I really just did a 180 on my life and now I'm feeling a little bit dizzy, like my blood pressure's too low now?
Yep. Oh, for sure.
Okay.
And it's funny you should say that because I have a patient in my practice who shall go unnamed, and he has done just that. And so he's lost about 60 pounds over the last several months, and he's just decided, look, I'm going to get control of my life. I'm going to really try and change this. I have taken away 4 of his blood pressure pills. He was on more than 4.
He was on more than 4?
More than 4 to get things under control.
Wow.
And 4 have been stripped away.
You get no room for lunch if you're on 4 pills.
I know.
Amazing. So it speaks to the potential of your willpower.
I remember in medical school that vague fact where a pound of tissue has like a mile of blood vessels in it or something like that. Or just like tissue has a lot of microvasculature. So that's why you need the pressure to perfuse the tissue if you have too much tissue. So weight loss, you guys must be sick of hearing this. We always say lose weight because that's going to help just about everything we've ever talked about in our videos.
Yeah.
It's a
common theme.
That is.
Common theme. So that's an awesome summary of blood pressure and what to do to lower it, and if you need medication, some things to think about. So if you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.